Positive, easy interactions.
It's easy to see why so many people enjoy the Red Shirt treatment with Independent Health. See all the reasons at redshirttreatment.com.
Inspired by actual member covenants, paid actors used, experiences may vary.
And now, the moment you've been waiting for, a senior moment with your host, Kerry Saunders. We talk about your health, staying healthy, your wealth and your golden years, and so much more. And now, a senior moment with your host, Kerry Saunders.
Good morning, good morning, good morning, good morning. Welcome to a Senior Moment radio show with Kerry Saunders. I'm your host, Kerry Saunders. Today's show, seriously, is a very, very important show. So if you're listening out there in Radio Land or looking at Facebook or whatever, stick to it, listen to about it, because it's today's show. We have Dr. Mark Perry, the senior medical director for Highmark Blue Cross Blue Shield on our show, and we're going to be talking about this respiratory illnesses that's going around, and it's hitting hard, especially this new one, RSV. I don't know if it's new, but it's all of a sudden it's been reared its ugly head, and COVID and how it affects the seniors and the people in Buffalo and nationwide. So this is a very, very good show, and you should listen in if you can. Roswell Park, the Comprehensive Cancer Institute, is the sponsor of a Senior Moment radio show. Roswell is one of the best hospitals in New York State for cancer. So if you're a doctor, your primary, or you think you see a problem, or the doctor says, you need to go get checked out, and they send you to somewhere, make sure they send you to Roswell to get the best treatment you can get. And Roswell is, it's important that we all get, especially when we get older, that we get checked for cancer. We get screening, prostate, breast, lung. It's all important, and then we catch it early. And you go to Roswell, right down the street. You've got a great cancer institute right there. So get an annual screening. Weather outside, it's not frightful. It's delightful. It's great outside. It's really, 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 really nice out. So get out and get some air, move around. I've had my COVID and my flu shot. You need to get that. And I guess the new RSV shot is important now too. So we're going to get right to our show because it's really important. We have Dr. Mark Perry. He's the medical director of Highmark, like I said before, Highmark and Blue Cross Blue Shield, and we're on the show. We have him here in studio. So I'm going to turn the over to him so I can bring him on video. Can we see you? Can we see you? We can see you?
Kerry, I can see me, so
right,
hopefully then the audience can. Yep, that works.
So, Dr. Perry, first of all, you're the medical director for Highmark.
Yes, that's right.
Tell us what you do and what do you do for Highmark, and how long have you been there?
So thank you so much, Kerry, and so happy to be here with the listeners. I've been a practicing doc for over 20 years in our community, and been with Highmark for over 6 years now.
Okay.
My main area of focus is not only for reviewing to make sure that patients getting the right care at the right place at the right time. As you had mentioned, do a lot of work with our teams for all those preventive screenings, making sure everyone's getting the screenings and all that stuff. Working with doctors and hospitals to try to make sure that they're getting, paid what they should get paid. And then work like this, helping out, the community understand kind of what's going on, and really appreciate the opportunity. And I know, our Highmark team really appreciates the opportunity here today.
Okay, so you've been involved with the viruses that are going on.
Yep.
And so it's important because I want to talk about RSV, and it's been very dangerous the last couple of virus seasons, right? What is RSV, and why are children and seniors affected such a high rate? What is RSV? So people know, because people hear about it on TV. I know a couple of people who've been hit with it, and it's debilitating. It's really seriously knocking them down.
Yeah, absolutely.
It's no joke here.
Yeah, no, it's no joke, right? And I think in terms of this time of year, we think about just respiratory season in general. So we talk about the regular cold, the flu, of course, COVID, and then RSV. So RSV, to your question, is respiratory syncytial virus. So respiratory meaning lungs, airways, nose all the way on down to your lungs. Syncytial really describes when the cells get infected, they merge, and then they create thick mucus in the lungs. And that makes it hard to breathe, makes it hard to exchange oxygen, so that one of the real concerns with RSV is if people get sick enough, their oxygen levels go down, and they may need to go to the hospital. So the real important thing to remember is RSV, excuse me. It's been around, not RSVP, right? But RSV has been around a long time. And as a peds doc, it's something that I've treated a lot of pediatric patients for, especially the younger kiddos. At the same time, it is also a real significant illness for seniors, and there's a new vaccine, actually 2 new vaccines that were just fully FDA approved earlier this year for RSV for seniors ages 60 and up. You need 1 shot. Generally, right around the time that a little bit before the season starts. So starting sometime September, October. And so right now, RSV season is in full swing from an illness perspective. When you look at the information and the data, RSV infections are more than both flu and COVID combined right now.
So now you say there's mucus stop you from breathing, and I know some of our listeners out there have heard about this and have seen it on TV and maybe know somebody that got it. So it's an important show. This is what we do here. We try to bring healthy things, what's going on in the community. So everything we talk about, all this stuff. So this is very important. So what are the symptoms?
Yep.
I mean, what are the symptoms for RSV, and why do they mimic COVID? I mean, why? They're very related, right?
And that's why we call it sort of the respiratory season. Pick your month. November, pretend.
When is the respiratory
April.
season, really?
So the respiratory season can be really any time of year, but the peak time of year, the time of year where you get the overlapping of all these viruses is right now. Generally, November. So it depends on the year, and that's the critical piece. You talked about RSV past couple years, and historically RSV was really seen October through April, November through April, that time frame. When we were in the midst of COVID with all the public health lockdowns, people staying home, kids staying home, wearing masks everywhere, RSV actually dropped significantly, dropped off, which was one good side effect. What we saw a year after that was that RSV wasn't following the normal rules. It was popping up a little bit in April, and I know my colleagues in the community, doctors, will remember that. And also, again, earlier than usual. And it was significantly higher because people hadn't been exposed to it the previous year. So being exposed to it or getting vaccinated to it will help you prevent getting sick enough to have to go to the hospital.
After COVID, it roared back, you might say.
It did.
It finally said, well, it's my turn.
Yeah, it's my turn, right?
Because
we stopped wearing masks, right? Because we went back to work, we went back to school, all the stuff we need to do. You asked about symptoms. So there's a lot of overlap in these symptoms, right? So you think of congestion, runny nose, cough, that's the common cold. RSV, flu, and COVID, same thing. But add with RSV, there's fever, wheezing is a very common thing. Remember, I talked about the mucus plugging in the lungs, so you can get wheezing from that extra mucus plugging, and that deeper coughing, really trying to clear that out. And when we talk about flu, you also think about some upset stomach, some aches and pains. And then, of course, COVID, all that, plus you remember the decreased smell, decreased taste, all that stuff. So there's overlap. And so when you're sick, it might not be easy to pinpoint, hey, I know this is RSV. Hey, I know this is flu. Hey, I know this is COVID-19. Well, we've got tests for COVID-19 you can do at home. But that's when you go, if you're feeling sick enough, you call your
There's
doctor.
no test for RSV.
There is, but there is. You get that in the hospital, the ER, your private doctor's office. But there's home COVID tests you can use.
So was it, before COVID, was it as deadly as it is now?
Same. Yep, it was. But now we've got vaccines for it. And so there's a new interest and awareness of it because we can prevent people from getting really sick, and we can prevent people from dying.
And I've heard, and God bless the family, I heard that some infants are dying.
Yep.
In the city of Buffalo,
Yep.
and there's a couple of seniors who have passed away from RSV. So is that occurring, or is that just a rumor out there?
Oh no, it's true. It's
Okay.
true. Every year, children, usually it's those really young, younger than 6 months, and seniors, often those over 65 or 70, but it could be any age. Usually where immune systems, maybe they're taking medicines to control some other health issues, their immune systems can't fight it, and they get really sick, have to go to the hospital, and unfortunately some people do die from this. This can help prevent some of that.
If a younger person, don't have to be a senior or a child, if a younger person has an ailment, they can catch it too and get very sick about it. So it's not nobody's immune to this, right?
Right. Nobody's immune, including, pure transparency, vaccines are never 100%, right? I mean, they're very, very good at protection, especially when we look at protection against being sick enough to go to the hospital and protection against dying. But people can still get sick from it. So you're right. It's everyone is susceptible to it, but the people that are most are those under 6 months as well as seniors and anyone with an immune system that isn't working quite right.
So you can catch it?
Yep.
I mean,
yep.
How
You
contagious
can
is
catch it.
How contagious?
Yeah, it's contagious. It's respiratory, right? So somebody coughs,
I heard
it's aerosols.
It's a very, very contagious. Like if somebody sneezes in a room with you, boom, you got it.
Not necessarily. So there's a whole bunch of factors, and what we've learned, especially from COVID, is that so we know viruses are tricky. What we've learned from COVID is that there's some things we can do to help minimize that. So even if I'm feeling fine, you're feeling fine, but if one of us had RSV right now, the other one might not get sick from it because of other factors, right? Our health status, did we get the vaccine, all that stuff. So it's not 100% contagious to everyone in the room, but it's something that we definitely want to be aware of and make sure we get vaccinated for if we can.
So you need to wipe down things and with alcohol and everything.
Like a disinfectant wipes. Yeah, disinfectant wipes. So I think. A couple things about just general sort of respiratory season. So one, as a doc, thinking about public health, if you're able, get the vaccine. Some folks can't. They've had a bad reaction to some, but the vast majority of people can get the vaccine. But to your point, you also talked about, washing hands. And think about all the measures we did when COVID was raging. We didn't go out when we were sick. We wore masks. We made sure to stay hydrated because we know that drinking enough fluids also can help as well. Obviously, wiping down surfaces, and then just if we're sick, just don't go out. Just let your body heal up, and if you're really sick, you go to the doctor.
Well, a day like today,
yeah.
I mean, if you're sick, should you still put a mask on and just take a walk around the block? Does fresh air hurt? Or you just you can't? I shouldn't say that, and don't listen to me because I'm not. Don't.
I know where you're going. I think I know where you're going, right?
Yeah, but I think if you're sick with that RSVP, you need to stay. You need to stay in the house. Right?
I would say, look, if you're sick, but you still feel like a little bit of fresh air might do you okay.
Right.
That's okay.
Why don't they offer? Because I wouldn't got my COVID and my flu shot.
Yep.
Why are they not offering the vaccine at the drugstores for that?
So. They should
RSV.
be. Yeah, I mean, they should be. And I was just in a grocery store yesterday, and I wanted to do a little research and see what was. I mean, they are available. It might have been when you went
so
that there could have been a shortage. Yeah, right. Always consider whether you've had reactions. Check with your doctor. But a lot of pharmacies, have these available. And we also know, there are flu clinics and everywhere else you can go, and not every place will have all the vaccines.
Is it too late?
It is. Oh, great question. Great question. No,
it's not too late.
It is not. It is not. Right. So currently, so if we look at last year, December 15th of 2022 was the peak of the flu season in Western New York.
Right.
That's last year. This year, we're seeing less flu, which is good, but it's still going up. And so it is not too late for the flu. And remember, it takes about 2 weeks to kick in. So you think about what's going on in the next 2 weeks. We got holidays, we got New Year's and all that. But
People
it is
shopping.
yeah, sure.
You
But
know.
it is never too late, right? It is never too late. So if
How
you
long
haven't
does
got
it take to kick in?
about 2 weeks. About 2 weeks.
Okay, you know what? Let's get to the creature, COVID. What's happening with? What is the latest update and what's happening with COVID?
Yep. Yeah. So, a couple things with COVID. One, there's an updated vaccine for COVID that came out in September.
Right.
And everybody who hasn't had that updated vaccine, the recommendation is please get it. I've had it. My wife's gotten it. And at the same time, there are other things going on with COVID too. So we know COVID, another one of these viruses, it's tricky. It keeps on mutating. But this one that right now is pretty good against COVID. Again, nothing's 100%. In terms of illness from COVID, we are seeing, we saw a real decrease over the summer, which is fantastic. But since September, October, we've seen a slow increase, nothing radical, but slow increase. People are in the hospital sick with COVID in Western New York.
So what are you seeing so far as the numbers?
Yeah.
That's COVID-19.
So with COVID this year, it's less than last year, and you know the data. So the data is tracked by the New York State Department of Health, by our Center for Disease Control, CDC.gov, and the data lags by about a week or two because it takes time to collect it and put it together. But if we look at how we're doing here in Western New York with what's called influenza-like illnesses, so let's say you and I go to the doctor's office and we've got a fever and we've got a scratchy throat or a stuffy nose or whatever. That's an influenza-like illness. And the national averages are about 4.2% of when people go in, they actually have an influenza-like illness. In right now in Western New York, we're about a little more than 2%. So we're about half what's going on in the rest of the country. With regards to COVID and vaccines, there's a big difference in who's getting vaccinated. So on average, across the country and also in our state, on average, it's only about a 15 to 20% rate that people got the newer vaccine. But when we look at that's it.
I got it.
That's it. I did too. Yeah. I did too. But when we look at folks 65 and up, it's about 37%, which is good.
Let me ask you a question, Dr.
Yeah.
Kerry. Everybody should have this, no matter what age you are.
So yeah, the recommendation is
this COVID.
For children 6 months and up. 6 months and up. For the new updated COVID vaccine, 6 months.
Everybody should have it.
Everybody should, but especially those, seniors. And actually, for COVID, it's anybody up 50 and up. So I'm in that team too. So 50 and up,
right.
As well as anybody immunocompromised, that sort of thing.
So you have people that are still suspicious of vaccines.
Yep.
And stuff like that. What do you tell them? I mean, what do you tell them about keeping healthy?
Right. No, it's one of those things that I have conversations with patients in the office and their families, and I did last time I was seeing patients. And it's one of those things. Ultimately, it's an individual's choice, so we just have to remember that. I like to look at the data and make a data-informed decision, right? And the most recent data I found on answering the question, what does the COVID vaccine do for hospitalization or death? And it cuts it by a factor of 10. Okay. And that was about a year and a half, 2 years ago. I don't think it's changed that much. So your risk of serious illness or dying from COVID drops by a factor of 10 with the right vaccine.
So you can't say it's under control, but you pretty much, the flu, everybody goes get the flu shot. So you pretty much, that's how it controlled it, right?
Yeah, and people, we're only at about a 40% flu vaccine rate in our part of the country too. So the goal really would be to get to 70, 80%, like that would be the ideal. But we're at 40%. And again, seniors, more, that sort of thing. And then younger children too. So children under 18, it's about 55, 60%, something like that.
So Senator Tim Kennedy just walked in.
Good
Pleasure.
morning. Good morning.
Dr.
Good
Perry
morning,
from
Buffalo.
It's a pleasure.
Doctor, thank you for being
Blue Cross
here.
Blue Shield. I'm going to put it
Kerry,
over to you.
thank you. Yeah.
So we're talking about the RSV virus, how it has affected the community, and being in the state legislature. I'm glad you I'm legislator. I'm glad you walked in. what's happening around the state with this virus?
Well, we have to keep our guard up, and COVID is not going away. Quite frankly, we this is the time of year that it's spreading. People are indoors once again. We have to continue to take precautions. I know the vaccine is so important in making sure that our vaccine is up to date, and we're just being careful in the community. We be mindful, like anything else. It's and the virus, doctor, you can explain better than I can, has evolved, and so it is the virus itself is a form of the flu, and it's one of those things that it continues to move and maneuver through society. So again, just being mindful that we're not entirely out of the woods, taking precautions, right, doctor?
Yeah.
Washing your hands. If you're in a crowded room of people and you're susceptible, wearing a mask, wearing an N95, just ensuring that you're doing the things that are necessary to protect yourself and your family.
Yeah, and I just wanted to add too.
Go ahead.
For all the listeners, don't forget that there's a flu vaccine, there's a COVID vaccine, and to the senator's point, these are viruses. So the natural state of viruses is that they do mutate, they change, and so that's why we need a different vaccine every year for the flu, and that's why we need a different updated COVID vaccines as well. And again, they're different illnesses, slightly different presentations, but a lot of the common sense recommendations that you talked about. Like, don't go to work if you're sick. Stay home if you're sick. Wear a mask, an N95. Wash hands. Wipe down surfaces. If you're feeling sick, don't go to that family gathering. Just protect yourself, protect your loved ones. All those apply.
Let me ask you a question, Senator Kennedy. RSV, the new virus that is affecting children and older Americans. I know you go all over the state. So is the other end of the state being affected by this too, like we are in Buffalo? Because it's starting to come on strong here.
Yeah.
Right? Am I wrong, Dr.?
No, you're correct.
Look, I think the doctor can answer that best. But the bottom line is, these are viruses, and like anything else, again, this time of year, we have to be careful. We have to take precautions. We have to recognize the symptoms, and RSV can impact anyone, but especially those that are susceptible to respiratory ailments. And again, I could talk to you about a lot of things, but you've got a doctor here that can answer these questions.
I'm just asking you for what you
of
course.
Look, this is everywhere, and look, the more
saying.
populated a place is, and the more dense.
Like you go to New York all the time, so
look, the more populated an environment is, and you walk into a room and there's 3 people sitting here 6 feet apart, you're less likely to get it than when you're jam-packed into a room like sardines at a holiday party, up in each other's faces having face-to-face conversation. That is how these viruses spread. We saw that magnified and exacerbated through the COVID pandemic, and it continues. But, just again, taking those precautions, being mindful that that's the environment that we're in. And again, making sure that you're protecting yourself and your family. That's the way to go.
Yeah. And what I would also add, this is great. I appreciate it. So I trained in Manhattan and New York City when I was in medical school and residency. And, although there might be some slight differences, one of the key things to know is New York State Department of Health tracks the vaccine sort of uptake in various counties, and different counties have different uptake rates. Here in Erie County, we're doing pretty well. Other parts of the state aren't doing quite as well. There are other parts of the state, like Monroe County, for example, that has actually got a higher rate of vaccination. So there is variability about different vaccine rates and who's getting it, but it is an across the state, across the country issue that we all need to be aware of.
So, Dr. Perry, because we got a couple of minutes left.
Yeah.
So, just tell our listeners the seriousness of this new virus. And then we've already went over it, but
happy to, yeah.
And what they should be doing right now, because this is serious, listeners. And I don't bring stuff on the show just to have somebody call in, or because we don't really take that many calls, but because we're very serious about it. And I think this issue I don't think we've seen the worst of it.
Yeah, I would unfortunately agree at this point. You know,
Right.
the most recent data, so Kerry, thank you so much.
Right.
The most recent data shows that RSV is on the rise and continues to do. I had shared that it is more, the current cases are more than both flu and COVID combined. And
really?
and yes, and it's still going up. So that's something that we all need to keep track of. In terms of protecting ourselves, the senator, spot on, you know. Get vaccinated against anything that's available. So to your point earlier, it is not too late to get the RSV vaccine. And for seniors, adults 60 and up, it's right now it's just one shot. There's no necessarily need for any future boosters. They're still checking on that and doing the research. Get your flu vaccine. It's not too late for that either. And get your COVID vaccine. It's not too late for that either. So all of those things, you know, as much as you can, get your immune system really prepped and ready, so that if these viruses come at you, you've got your best shot at defense. Masking, wiping down surfaces, staying hydrated. If you're sick, you stay home. Protect yourself, protect your family members. And really, again, in this holiday season, just be extra aware of that. But again, it is not too late to get vaccinated.
This is not a warning that, you know, go grab a mask and stay away from people. It's a warning just to be careful, right?
100%.
And
Yeah,
I think
absolutely.
that's what we need to do.
Yep.
We need to be careful because I'm seeing this a lot of the RSV, and it's spooky. And I don't want anybody I know or any of our listeners know to get this terrible virus because it's not as bad as COVID, but it's a quiet assassin.
I would say it's a quiet assassin.
Yeah, man.
So I would say it depends. I mean, you know, people in the hospital, it's bad. You know,
There's a lot of people in the hospital in Buffalo. No?
So I don't have those numbers right now.
But,
I can get them to
yeah.
listeners, but there are folks in the hospital right now that are fighting for their life with any one of these illnesses.
That's just bad.
Absolutely. Yeah.
Senator Kennedy, tell us you had your shots.
Of course I have. I wouldn't be here next to the good doctor if, you know, I came in
people listen to you in the community and just tell them what you think they should be doing right now to fight this terrible virus that's hitting us in the community.
I think just taking the advice of Dr. Perry here and your own healthcare practitioners. And I think this isn't a unilateral piece of advice you're hearing on the radio today from Dr. Perry. This is uniform advice, you know, across all the healthcare spectrums. Those healthcare practitioners are saying make sure during this season you're protecting yourself by taking the precautions necessary.
Yeah, it's really rough out there. This is not a joke. This is really scary. And I've witnessed a couple people who come down with it. Dr. Perry, would you like to say anything last? Because we got to go.
Yeah, no, absolutely. Appreciate the time. Thank you so much. And you know, hopefully that folks listening, if you haven't had your vaccines, go get them. It's not too late. Practice those protection measures we had talked about. And have a wonderful holiday season.
And it's easy because you can go to a drugstore now.
Yep.
You get it.
Yep.
Just call and make an appointment.
You can walk in. My wife and I typically just walk in. We wait about 10 minutes or something like that.
Right.
Again, it depends. Don't go at 5 o'clock on a Friday night.
Right.
But it's something that's generally available in most drugstores.
Hey, this is Kerry Saunders. Listen to what we just talked about because that's very important. About this new RSV peak. That's why we have it here, RSV, because it's a scary thing that's happening right now. And I don't want to be on the forefront of something scary, but we got to give you the information. Senator Kennedy, would you like to say anything before we go?
Yeah, just happy holidays, everybody. Kerry, thanks again for a great show. Dr. Perry, always good to see you as well.
Dr. Perry,
Thank you.
Say bye to us.
Thank you so much, all. Appreciate it. Happy holidays.
All right.
Thank
Go
you, Kerry.
Bills, baby.
Yeah,
That's
go
right.
Bills.
Go Bills.
Go Bills.
Go Bills.
Hey, this is Kerry Saunders. See you in a moment. See you next week. Be safe. Get your vaccination.
Join Kerry.